Hello and welcome to the Art of Medicine. I'm Dr. Motahare and today we are exploring a very common condition, anemia. We will talk about different causes, diagnostic options, and also available treatments. Let's get started. So, what is anemia? Anemia is a condition when your body doesn't have enough red blood cells or hemoglobin, which is a protein inside the RBCs to carry oxygen to different tissues. This means that less oxygen reaches to your tissues, which can make you feel tired, weak, or out of breath. It's not a disease itself, but it's a sign of something else is going somewhere else, and we should find what is that problem. There are many types of anemia, and each of them has different causes. The most common type is iron deficiency anemia, and it's usually the result of blood loss or poor diet. It's more common in toddlers, ladies, and elderlies. The blood loss can be obvious, like menorrhagia or any kind of trauma, or a cold, like a small blood loss from digestive tract or urinary tract. The other one is vitamin B12 and folate deficiency anemia, which is a nutritional problem or a malabsorption problem. This means that you can take less than enough vitamin B12 from your diet, or you have some kind of problem in your GI tract, in your digestive tract, that cannot absorb vitamin B12. This kind of anemia is more common in elderly because they have also nutritional problems and also malabsorption. The other one is a kind of hemolytic anemia. This means that the production is okay, but the red blood cells are destroyed too early. This type has many different etiologies that we are not going to talk about that today. And the other one is anemia of chronic disease. This is a wide range and linked to chronic long-term illnesses like kidney disease, diabetes, different rheumatologic problems, or even cancers. There are other types of anemia too that are a kind of um, more uncommon, and I'm not going to talk about them today. Symptoms of anemia is different based on the severity and the cause. The most common symptoms are completely non-specific, like fatigue, weakness, pale or yellowish skin. You might experience dizziness, shortness of breath, especially when you are doing some exercise, and also cold hands and feet. In more severe cases, there may be chest pain or irregular heartbeat, but all of them are non-specific. Diagnosis usually starts with a simple complete blood count test, a CBC test, which is a simple blood test. The result of this test will guide us to the next steps because there are lots of parameters there. If it's a kind of, or if we are thinking about iron deficiency anemia, we will order serum iron, TIBC, and ferritin. If we are suspecting vitamin B12 deficiency anemia, we will ask for vitamin B12 level in the blood. If you are thinking about hemolytic anemia, we will ask for things like peripheral blood smear or hemoglobin electrophoresis, G6PD test, reticulocyte count, and many other things. If we are thinking about anemia of chronic disease, we will look for underlying disorder. The important things here is that if we have an elderly, men or women after menopause, and there is signs and also lab results of iron deficiency anemia, we should for sure look for source of bleeding. That means completely evaluating the gastrointestinal tract, the urinary tract, and also any other places that can cause a cold bleeding. This is very important. We shouldn't have anemia in men and women after menopause. This point is very important. Treatment is based on the type and also severity of anemia. For iron deficiency anemia, we have oral or IV iron supplements that based on the patient's tolerance and also severity of anemia, we decide which one will work. For vitamin B12 and folate deficiency, we will treat with supplements or injections. In chronic disease anemia, the underlying disorder uh, should be treated. In severe cases, for example, if you have a kind of acute blood loss, blood transfusion may be necessary. Or when we have a kind of severe hemolytic anemia, like the thalassemia major, or a kind of uh, very severe hemolytic anemia, maybe we need to do a blood transfusion. And also in certain very rare conditions, maybe we need some kind of other treatments like bone marrow stem cell transplantation. This is very rare. The important thing to remember is that anemia is common but treatable. Just we should understand the cause, diagnose the etiology. If you are feeling persistently tired or lightheaded or just not yourself, don't ignore it. Maybe it's a kind of simple anemia. Talk to your doctor and ask for a simple blood test. It could make a big difference. Thanks for watching. I hope you find this information helpful. Please like the video, subscribe to the channel, and leave your question or thoughts in the comments. Stay healthy and see you in the next episode of The Art of Medicine with me, Dr. Motahare.